What exactly is happening with the U of M's medical facilities, and how much is it going to cost taxpayers? In tonight's Talking Points, Esme Murphy looks at a proposed merger and what that would mean for the future of facilities thousands of us depend on for care.
The University of Minnesota Medical School and its facilities are prized for their research and for the fact that 70% of Minnesota doctors are trained there. Barreling forward, though, is a proposal that would merge South Dakota-based Sanford Health with Fairview Hospitals that oversee the U of M facilities. Back in the 90s, Fairview bailed out the U of M medical facilities, and they have been jointly operated ever since. Fairview even provides $80 million a year of funding to the U. There is a very rapid timeline for that merger that would complete the deal in little more than a month. That could mean control of the U's taxpayer-funded facilities would be transferred to a company based in South Dakota. There are widespread concerns about that, including having a headquarters in a far more conservative state where abortion is illegal. Those concerns are why the state blocked this same proposed merger back in 2013. But now there is a second scenario. In light of the merger, the U of M is proposing buying back its medical facilities and building a new hospital on the East Bank campus. But there is one big question. The U would need taxpayer funds, and no one is saying what the taxpayer bill on that would be. Myron Franz is the Senior Vice President for Finance and Operations at the U of M. He was a guest on WCCO Sunday morning at 10:30 a.m. How much is that going to cost taxpayers?
Don't know the answer to that yet, and I know that it's a big question.
Well,
it's not a simple sale, and it has that those assets have to retain the purpose for which they were created, which is the service of the university's academic health mission.
Minnesota Attorney General Keith Ellison is conducting a listening tour, stopping around the state to hear what people have to say about the proposed merger. One big worry that the merger could make health care more expensive. Sanford maintains it will do just the opposite and make quality health care more accessible in farm and rural areas. Ellison has the power to block the merger by filing a lawsuit, but he hasn't said yet if he will do that. So the months ahead will shape what is a very uncertain future for the university, its medical facilities, patients, and taxpayers. Esme Murphy, WCCO 4 News.